What is PRP treatment? PRP is nothing but platelet rich plasma. So the blood that is pinned is fractionated into the various components, and we collect the plasma that is rich in platelets. This particular plasma has regenerative properties because this, when injected into the tissues, releases growth factors. So the various different types of kits on the market. There are kits that need activation, there are kits that where you do not need to activate it, there are also kits that will purely concentrate the growth factors instead of the platelets, so the various different types of kits. So all these advanced mechanisms will ensure, will help to regenerate the follicles. The hair follicle goes through different stages of development, and in those different stages we have the anagen, which is the actively growing phase, and when this phase is shortened, or when it goes into the resting phases and the degenerative phases, that's when you notice a lot of hair fall. So one of the first signs or symptoms of hair loss is when you notice a lot of hair thinning. The hair naturally becomes very thin and then it goes into a resting phase. So if we can catch the clients at this stage where they're experiencing hair thinning or hair loss, then most of that hair can be regenerated by means of these mechanisms. There are also other products on the market like minoxidil or finasteride and hair transplantation. These are the definitive ways of regrowing hair, but also PRP, which is generating a lot of news these days. So the kind of PRP that we use in here is the growth factor concentrate, which is directly concentrating the growth factors and is more specific to the scalp hair. Once we collect the growth factor concentrate or the platelets, the plasma that is rich in platelets, we prepare the scalp, we clean it, everything is hygienic. Sometimes we numb it, sometimes we numb it with ice. We use different ways of numbing the skin depending on the patient's preference. And then we inject the solution into the scalp. And sometimes we even use derma roller to get the solution into the skin, but mostly we inject it. And this treatment is repeated once in 4 weeks for about 3 times. And if the condition is something that is very dynamic, that is constantly happening, that is like androgenetic or a male pattern alopecia, so there are various reasons why it happens because of your hormones and other things, so they may need also maintenance. But if the condition is also correctable from maybe a deficiency in vitamins or thyroid hormone, then if that is corrected, then you may not need to have regular treatments. So the cause needs to be determined by your dermatologist, and then you can decide on the number of treatments that we need to have. You can find me on Skin Beauty Pal, which is available to download from the Play or the App Store by using my clinic code BG0303.